I chain smoke and I say fuck a lot. But I accept myself for the way I am. I accept you too. Viewer discretion advised.
We've all heard of racism, but we may not realize that racism is more than people treating other people unfairly because of their race, language, or culture. Racism includes the systems, policies, and practices that unequally hurt or disadvantage people who are not seen as white. Some people might think these things are in our past, but even today, there are still policies in place that harm people who are not regarded as white.
I saw this the other day. On January 12th, the CDC uploaded to their YouTube channel a couple little propaganda videos. Health equity, social detriments of health, racism in health, and intersectionality. And I mixed them together.
What is intersectionality? It's a long word you may not have heard before, but it's everywhere, and it affects our health. Each of us has a unique identity. Elements of our identity can be used to categorize us into groups. All of us are members of multiple groups. We may be younger or older, a certain gender, race, or culture. For some of us, certain aspects of our identity may change the way we're treated and have an impact on our health. As examples, some people may experience gender discrimination in a work environment, and research shows that some people in racial and ethnic minority groups in the US have higher rates of heart disease than people who are white. For some of us, being a member of more than one group that experiences some disadvantage can compound or even multiply the degree of inequality we experience. How people are treated based on their skin color, gender, having a disability, sexual orientation, and other factors interact to affect people's health and other aspects of their lives. Intersectionality is when aspects of our identity overlap. This overlap may contribute to unequal health outcomes in ways that cannot be attributed to one dimension alone. For example, pregnancy-related deaths for college-educated Black women are 5 times higher than pregnancy-related deaths for college-educated white women.
Huh? It's quite a subgroup.
Black and Latina transgender women are victims of homicide at far higher rates than white, Black, or Latina cisgender women.
I don't really get this because it was reported that in 2022, at least 32 transgender people were killed in the United States. So 32 were killed in the United States. There weren't more than 32 straight women killed in the United States last year.
And research has shown that as a group, gay, lesbian, or bisexual people of color have a higher risk of cardiovascular disease than white heterosexual people.
While a person's race does not increase their risk for poor health outcomes, race is a marker or a sign of other factors in our society that increase the risk for negative health outcomes.
The intersectionality framework can be used to provide an equity lens for public health professionals. Public health research and practice are better when we are aware of how different forms of oppression are interrelated and contribute to varying levels of advantages or disadvantages.
They always have to make you think that you are the victim.
We were programmed to be victim, and a victim has no power. And as long as you believe you're a victim, then you manifest victim.
Even if it doesn't always seem like it, we have the power to shape the world we live in. We can make things different and better and fair for everyone. We can create health equity. Health equity is the opportunity for all people to be able to attain their highest level of health regardless of where they live or their personal stories. Addressing health issues at the individual level is not enough.
When medicine veers away from the Hippocratic Oath, which is an oath that promises to respect the individual right, to do no harm to the individual. If you don't harm the individual, you're not going to harm the community. But if you wipe out the individual's right, their human right, then you're going to harm the community as well, because the community is a bunch of individuals. It's not some other entity.
It is far more powerful when we help everyone in a community at once by making changes that affect their physical, built, social, and policy environments. To achieve health equity, we rely on connecting science, policy, and practice to put real change into place. That's where public health can play a major role in helping to achieve health equity. When public health champions work collaboratively with those of housing, transportation, and education, we can move towards creating fair and equitable opportunities for everyone to be healthy.
Public health wants to get into everything. It reminds me about what Dr. Day said about housing in 1969.
Ultimately, people would be assigned where they would live, and it would be common to have non-family members living with you, just by way of your not knowing just how far you could trust anybody. This would all be under the control of a central housing authority.
You got to eliminate that compliance, and you make it a mandate. And then you do training, particularly in the city, I'll call them licensing departments, whether it's zoning, buildings, housing will be impacted by it, planning certainly. And you pick the people to run those agencies and the deputies that are pledging allegiance to the New World Order.
Public health professionals and communities must continue to conduct and share research about how racism impacts health, develop effective interventions that counter racism, and develop and support policies across sectors like transportation, education, and housing that eliminate racism and its effects on health.
Fucking stoned.